Welcome to the American Institute of Healthcare Professionals Videogram on mental health. And in this video, we're going to look at mental health, why it's important, and also the various maladies that can become associated with mental health itself. So making mental health a priority is something we should all consider, just as we take care of ourselves physically. If we become ill, we want to also make mental health that same level of care that we would give our physical body. Part of the problem is individuals fear the stigma associated with mental health or being labeled as crazy. So that label is beginning to be removed slowly, but there are still prejudices that exist that diminish individuals who show mental health issues, considering them weird or considering them crazy. So once these labels start to disintegrate, we as a society, then mental health can receive the attention it needs, and individuals who have mental health issues can more confidently display to others what they are feeling and be able to find the appropriate help that they need. And mental health days and awareness are very important in doing this. Individuals taking a day off, maybe if they're not mentally completely there. National mental health days that recognize certain maladies, just to give public awareness so that there's an understanding of why certain maladies or disorders exist. In addition, grief and stress are natural parts of life. As a living organism, we adjust, we adapt to change. Sometimes, though, we can become overwhelmed, and these situations can become toxic. They can become chronic, and this has negative effect on the body. So we sometimes have to get help. We have to have help to work through these issues. And that's where talking and sharing is very important in dealing with these daily issues. And the most common physiological disorders, mental disorders that are exhibited are these things that deal with grief and loss, and in itself, stress and anxiety. The most commonly diagnosed disorder is depression. And the number one reason why individuals go to see a counselor, a licensed counselor, is over issues of grief and loss and anxiety. Other issues include ADHD, attention deficit hyperactive disorder, or OCD, obsessive compulsive disorder. And fortunately, most of these disorders can easily be treated with cognitive therapies or a variety of medications that balance neurotransmitters as dopamine or serotonin. In addition, individuals go to counselors just for basic phobias or sleep and eating disorders or stress management. So there are a variety of everyday issues that affect mental health and are the bulk of the population, why individuals go and seek the help that they need and have very minor fixes that just usually include a couple therapy sessions and maybe a medication regimen to take. And then the individual is able to function at an optimal level in itself. However, there are deeper wounds psychologically. There are worse maladies that can affect one mentally that require more intensive therapy and help. And a lot of these are products of trauma, products of chronic grief, which turns to depression, products of intense anxiety and stress, which can lead to post-traumatic stress disorder. They can lead to poor treatment as a child in regards to care, which can lead to attachment disorders. So individuals in their 20s, as they enter into young adulthood, have a horrible time forming healthy relationships with others. They have very insecure attachments, which can be avoidant or anxious in their very nature. Depression, untreated, can become worse through major depressive disorder. It can be seasonal, and it can also be bipolar, which is marked by states of depression and then mania itself. And obviously also self-harm I have listed, which can be also due to past trauma where one feels the need to punish oneself or to physically cause pain to numb the mental pain itself. Another type of disorder is borderline personality disorder and a variety of rage disorders. Borderline personality disorder hampers relationships much like attachment disorders, and they are again due to insecure bonds and connected to early childhood trauma. And borderline personality prevents stable moods and causes drastic mood changes from moment to moment. Also, rage disorders are common. IED, which is also referred to as intermittent explosive disorder, produces sudden episodes of impulsive aggression and anger in itself. There are also cases that go beyond trauma, but deal with a abnormal brain, a confused brain, various cases of a psychosis, which can be acute or chronic over time, causing delusions, schizophrenia, which has its own delusions, random emotions, and disorganized speech, all again stemming to an abnormal brain. Dissociative identity disorder, which creates multiple personalities within an individual. And again, this has to deal with going back to a particular trauma and trying to escape it. And dementia, which is the loss of self itself, the loss of memory as the brain itself deteriorates. There are also a series of antisocial personalities that can be created, unofficially labeled sociopath and psychopath. And there's the great question of what creates these type of personality disorders. Is it nature or nurture or a little bit of both? And in these cases, we see individuals that have no conscience, those individuals who break away from social norms and laws and put themselves above others with delusions of grandeur. They are also closely associated with narcissistic disorders, where a complete love of self that is unproportioned to caring for others begins to exist. So there are a variety of the type of mental disorders that can exist. This was just a brief listing of some of them. The main emphasis, though, is that mental health is health itself. It is just as important as physical health, and it's important for one to seek the professional care that one needs if a variety of mental health situations occur. Most of them usually just deal, again, with depression, anxiety, basic phobias, or OCD, but they are still nonetheless important things to be treated so that an individual can function at their full capability and capacity in itself. In many cases, licensed professional counselors are required for this. On lower level, there can be pastoral counseling if it's just with basic loss, as long as it's not a malady. So if one's trying to cope with stress, deal with grief, or deal with basic anger, you can have an unlicensed professional work with you. But if it takes to a higher, more malicious level, where it becomes maladaptive, then a licensed professional counselor is definitely required. Here at the American Institute of Healthcare Professionals, we offer certifications for non-licensed professionals as well as licensed professionals who wish to grasp a better understanding of mental health at the more lower levels of care, with grief, with stress, with anger, with crisis. So these types of areas are still very crucial for everyday health, and pastoral or non-licensed counselors need to have training in that, but as well as licensed counselors who like to continue receiving continuing education or who like to add certifications to their already impressive resume to be able to help others and to refresh or to add some new ideas to what they have accumulated over time. So please review AIHCP's various mental health care certifications that we have to offer. There's a link below. Our phone number is 330-652-7776. and our email is info@aihcp.org. Thank you for listening and have a good day.